Hello, you guys. Welcome to the Holistic Hive podcast. This is Dr. Christina Stitcher, and I am here with Kim Painter. She is a physical therapist and really specializes in kiddos, and especially when we're going to talk a lot about lift high, tongue tie, but she has a very unique journey and a really wonderful setup and an opportunity actually with her son, who's a chiropractor. Yes. And so just tell us a little bit more about yourself. I'd love your journey.
All right. So I have been a physical therapist for 37 years next month. I went to Northwestern University, and actually it was there that I was first introduced to cranial sacral therapy in a 2-hour lecture in our musculoskeletal class. And for whatever reason, it just really hooked me, partly because, this is going to date myself, but I'm like, it's 1985. How could there be a system in the body that we don't know about it? But since then, we've found it several more.
And at the same time, there's still so much that we still need to learn. Yes.
So much. Yeah. Where it's just a drop in the bucket what we know.
Right.
Which is really exciting.
Yeah, exactly.
But anyway, that's where I was introduced to cranial sacral therapy. And it took me 11 years and 4 kids and moved to Texas to get to the point where I took my first class.
Wow.
And I was trained as a pediatric PT, so I worked in a pediatric hospital in Dayton. I was working in the school system in Ohio, and then doing general stuff too, because I love kids, but I love everybody, and so I want to help people. Yep. And so I took my first cranial class and had an actual, this is going to sound funny, but I fell 2 days before the class.
Okay.
Jammed my sacrum, sprained my ankle,
couldn't sit,
couldn't walk. Had to take this class because I had to renew my license the next month.
Yep.
And I felt things in that class on myself that it was not how I was taught how to do that at Northwestern University, which is a very good school.
Yeah.
And so it really just kind of shifted my mind, okay, there are other ways to approach the body. A little bit more holistically, a little bit more as an individual who comes with their whole life experience to where they're at when they come to see us. And so that just started a journey of really specializing in cranial. I thought, okay, I was thinking, I just want to get to the next class.
Yep.
And when we teach, so I teach now for the Upledger Institute. And in our first class, we tell everyone, before you can take Cranial 2, you need to do 75 10-step protocols. And so I was doing them on whoever would let me put my hands on them. And within literally about 6 weeks, I had people that I didn't know calling me and saying, hey, could you do that thing that you did on so-and-so? Yeah. And so I started to practice with 4 little kids at home out of my house.
That's amazing.
And everybody was saying, you can't do PT that way. And I'm like, maybe not, but I'm still going to.
Somehow doing it.
I am.
Exactly.
And so that's what I did. And I had a full practice until we left Texas 3 years ago. And I started teaching. And then the huge joy for me was that 7-8 years ago now, the Institute asked if I would come and start to teach for them in the conception, pregnancy, and birth curriculum.
Love it.
Which was like a dream come true.
I was going to say, that's huge. Yeah. So I took Upledger when I was in chiropractic school and did the Cranial Sacral 1. And when you say the 10-step protocol, it's a full hour-long protocol. I know it and everything else. And you go, it's a really intensive program to learn, and it's really just like the baby steps into it.
Right.
And what a great one to be at with not feeling great, to feel this shift of healing and holism. Because I think that's I love that you say it, and it's such a beautiful point to make, is that I think in traditional physical therapy, we're still partitioning out the body, and we're forgetting that the entire body is connected and whole and working, and it's designed to communicate. And then you look at Upledger and you look at that opportunity to dive in, take it further. What is it, other than being a mom already, that got you just to love even into birth and babies? What was that transition?
So part of it was I'm one of 7 children. Towards the top. I'm tied for second of 7.
Right.
And so I've always loved kids and being with kids, and I'm comfortable with kids, and my inner child is alive and well, very easily accessible. So that's part of it. But then in PT school, literally all the electives that I were taking were pediatric, and actually the one and only obstetric one. This was before pelvic floor PT. There was nothing about that. And so I just have always been drawn to it. And I think, I don't want to give you too much personal information, but I had an experience of having gone through trauma as a 4-year-old
Yeah.
that was completely not appropriate, and I had my own healing to do.
Yes.
And I really think, the whole archetype of the healer's journey,
Right.
a lot of times it's because
Starts
we have
there.
things, we have our own things to heal. And so whether that was contributing to it kind of on a non-conscious
Right.
level, until it then became conscious as I started actually working on those things and healing those things, that might have been part of it. So I think it was just probably a combination of things.
I love it.
And then having your own babies.
Right.
I mean, I have 4 kids. My first were twins, and I was totally in love with these babies.
Yep.
And I think, why not help them not have to go through, I think everybody is walking around with stuff from their birth.
Right. Yeah.
And not just physically, but
Right.
emotionally. We pick up things.
Absolutely.
Babies are so aware and so sentient, even in the womb.
Yep.
And so if we can help them not have to deal with some of that stuff from the beginning,
Yes.
and just watch them be more embodied, more comfortable in their own skin, realize where their boundaries are, what they can contribute to and what they cannot, or not contribute to, but what's their responsibility to deal with and what's not. It can change their whole world.
You look at it, there's some really good research that babies that, it's unfortunate research, that babies were desired, like at that moment of conception, if they were desired, they're easier to soothe, they're more connected than a baby that was not desired, even if later on the parents were okay with it, or the parent.
Right.
And so it looks at this going, once you realize it, you go, oh, this is such a big deal. This connection that is in utero that's starting is so important.
Right.
And how do we help bridge that? And so when I look at this, I want to stay here for a second, because I'm assuming we have lots of women listening that are business owners. And I did not have a female mentor ahead of me. I actually look at the profession and go, you're so welcome. And now we have women who are willing to share our bruised, broken journey at times of what we learned.
But you're told you can't do that.
You can't do that, and this is the only way to do it, which is a male model, and especially with kids, it's like, well, who do I sacrifice?
Right.
And sometimes it's often us is what actually who gets sacrificed. And so I'm curious, maybe, and I am, like, what advice, or how would you say, like, that journey, what would that give you to that younger self now, who says, I really would love to do whatever business, especially healing art, and yet I want to have children?
This is huge. And I actually have this conversation quite a bit, because I mentor students across the country now. In the same, not students, therapists. I think the biggest takeaway that I would give to myself back then was, there is not just one way to do it.
Yes.
And your way is a very valid way.
Yes.
And if it feels right to you, that's what's right to you.
Yep.
And if somebody says you can't do something, just keep doing what you're doing.
Yep. I think it's so important, and I love this. It's like your journey is going to be unique, and the other, I add one more caveat to that, is how you do it this year may look different than next year.
Exactly.
Because this is a path of parenthood that we're on, and it does look different, and we have a very unique position as women and as mothers that we need to learn to navigate differently than the men, and go, and that's okay. There's not a right or wrong.
I think, going back to when I first took my Cranial 1 class, I had this little thought. It wasn't mine, but it was like, you could teach this someday. And I kind of had that in my mind. And then I got caught up in raising these 4 little kids, still trying to do my training on the side, seeing clients during nap time or after bedtime, or then during school hours, but having to figure out how to do this in the way that worked for me, because my kids and my family was definitely my highest priority.
Right.
My kids all knew they could go write their name in my appointment book anytime they wanted. And so, and I have all those appointment books. So I can go back and be like, tennis tournament, soccer practice, those things are in there.
Right.
Which I love, because it's kind of a record of how we moved through that.
I was going to say, that really is.
But I had kind of given up that dream of I'll be able to teach. When that came, when that opportunity just fell in my lap, I mean, really, I had to just let it go. It was my youngest son's senior year that I was invited to do it. The timing was perfect.
Exactly.
Because as the youngest, he's like, yeah, I don't need you guys hovering over me as we're making that transition of our baby learning that mess.
Right.
And so it got me so busy and focused on this, and so when he needed me, he needed to say, I need you.
Right.
And I was paying attention, but it was like, hey, if you're good, I've got a couple things to do.
Exactly.
And so really the timing was perfect. And as I look back on that too, that's probably another message I would give my younger self of the timing is beyond your control and it will be just right.
I think I love the expression, you can have it all. You just can't have it all right
at the same time.
Exactly. Yeah. And go seasons. And this is a season and a stage, and I think it's really a beautiful forgiveness journey, no shame, guilt of going, what can I do now? What do I choose?
Right. Yeah. You know, the other, this might be getting a little off topic, I love it, but really another message I would have given myself was, don't give up on the stuff that you love to do. Yeah. Because at some point, this season of motherhood is going to change. You're still involved with them, but it's not the day-to-day stuff. And the friends I have who their last kid left home and they're completely lost. Yes. It's because they didn't have their own passion and desires or interests that they want to pursue. And they're kind of like fumbling, like, what do I do
now? Who do I want to be now?
Who do I want to be?
And I think that's so important to say, because it may be that this business, this profession, whatever it is that you've invested, the certification, the licensure, keep it going, keep on doing the CEs, keep on doing whatever it looks like right now, because at some point, life is different.
It is different.
And then you get to reevaluate, where do I want it to head.
And it's a gift to your kids. Yes. One, I think it models for your kids. Your interests are important, which is an important thing from them to know. Mom's a person who likes to do things.
Thank you.
But also, it's a relief for them not to have to worry, are they going to be okay?
Yeah, exactly.
So,
and that burden, I think is a really good point to say. It's like, I want my kids to know, it's like, I have a big life. And they're part of my big life. Exactly. And you can do anything and everything you want. And I think it's a beautiful place to go. I love it. Okay, so now take me into, what are you doing currently in your clinical practice?
Okay, so again, one of those blessings that I thought had gone away. My oldest son, Jason, who Dr. Stitcher knows.
I know, we have to say this, like, we just found this out today, so we're totally gonna get the shout out. We're comparing, and I'm going, hold on, I literally pause. Is your son Jason Painter, because I taught him when I was faculty at Parker University, and I was only faculty for a year, and yet he spent a lot of time in my office, and he's a special man, and I'm so thrilled he's in Utah practicing as a chiropractor and blowing it up, helping and serving a ton of people. So this opportunity came.
So we had talked about having a practice together. In Texas.
And he talked to me about it, just so you know. That's what's so funny, is I'm like, hold on.
Okay. So we had that dream. And then I just realized, I don't know if this is going to be the right place for you to come. Look at your other options. Yeah. And he had to struggle with it a little bit. Wait, this is what we were talking about. Right. And I'm like, I know, but mom first. Yeah. You need to do what's right for you.
Good for you.
So he ended up here 6 years ago. Yeah. And so I really had kind of let that dream go away. Yeah. And then 3 years ago, my in-laws needed some support, and so we moved here. And here I was with Jason. He's like, Mom, we can do it.
Yes.
And so we do. And so I'm working in my son's chiropractic office, MuscleWorks Chiropractic. So we have a Farmington Clinic, which is the one that I work in because I live in Bountiful. Right. And so, and then they have an office in Orem, and they have an office in Heber. And so he started, when I started, he was there 2 days a week, and I was only working 2 days a week because I came to support my in-laws. So we were there the same 2 days, and then he got so busy in Orem that he's just down there. Okay. He's there 4 days a week, and then up here just 1 day a week. Yeah. But truly, just hearing the insulation is not good, so I can hear him literally in the hall in his treatment room. And that first day, it just filled my heart with joy. And it's lovely because I can say, if I have a client that I can tell, okay, C5 is rotated.
Yes.
Let me just step out and see if Jason's available. And so that first week, it was so funny because I was thinking, let me just step out. So I step out, and he's stepping out. I said to him, Mom, can you come look at my...
Oh, I love it.
So we just kind of high-fived each other.
Exactly.
He checked my client, I checked his, and it just is a gift.
I was going to say, what a beautiful opportunity.
It is. Chiropractic and Cranial and PT are very complementary.
So wonderful together.
Yes.
Okay, so I know that you have a huge name in the lip tie, TOTS, revision type world.
Well, I don't know that I have a huge name. I work with them. Okay, so babies with all the challenges. Birth is an intense experience.
Yep.
Even the most natural, beautiful, healthy birth is a very intense experience. And like I said earlier, all of us are walking around with things from our
Carrying
birth.
it. Yep.
And we're all very functional for the most part. You know, so it's not that we won't do well, that these babies won't do well. But again, why not help them? So with lip tie and tongue tie, they need some support. So for some of them, you can actually see that frenulum come all the way forward. They need a revision.
Right.
It's just, it helps them.
I was gonna say the research is there. They need support, and I've become a fan of revisions when they're necessary, when they're appropriate, because we just see literally the unwind, like with the body work.
The whole body.
I was gonna say, like, and I'm gonna preface this conversation saying we know the research is very clear. The combination revision when needed with body work and with supportive lactation consultant is like the trifecta of amazingness. And so I love that we can say that.
Need.
Okay.
Yes.
So then you have all these babies in that slight gray area.
Right. Because there are times when it's not just the frenulum that affects tongue function and mobility. Think about times when you've woken up with a crick in your neck and eating and drinking is hard because you can't turn your neck. It's not the frenulum.
Right.
You do need some body alignment. There's an alignment issue. There's a shortened muscle. There's a incoordination. Is that the right word? My daughter, who's the editor, would be like, "Mom, you're not saying the right word." A lack of coordination in how the cranial nerves are firing.
Absolutely.
It takes 6 cranial nerves to coordinate suck, swallow, and breathe. And so if any of those, if there's a glitch in any of those, then they need body work. And in those cases, cutting the frenulum isn't going to change anything. And so having an assessment and looking at what's going on with the baby, the whole baby, not just under their tongue or their lip, makes a huge difference because they need whole body support.
And I think I'll be the mean one who will say actually cutting that frenulum when neurologically they're not in a place to handle that actually could be more detrimental.
Absolutely.
And I know that's not what you want to hear as moms, but it's the truth. And it could be why you say, well, I did this because I was told it's my only option and it would fix everything, and it didn't. And so now I'm stuck. And the answer is no, you're not. And there's so much that still can be done, but it could help explain the struggle that you're going through and the struggle that people are having with their babies going, well, I was told it's just a revision, and go, it's so much more.
It is so much more, especially since we have gone to the laser. Okay, so lasers are amazing. Totally support the use of lasers. But when you're talking about such a tiny little area, and the laser, even the best use of one, can create a bigger wound bed than if you came in with like scissors. Actually, what used to happen, midwives used to just keep their pinky finger long and they'd look at the baby and say, oh, it's tight, and they would swipe right there at birth. No big deal.
Interesting.
So that's what I find often is that these babies who are going in for the laser revision didn't work the first time. They think, well, maybe we didn't go far enough.
So we'll do deeper.
Another one. I worked on one baby that had 4 revisions. So this baby was so orally defensive.
Yes, absolutely.
Wouldn't take the bottle, wouldn't take the breast.
Absolutely.
Was just miserable. And you can't blame him.
No.
Because there was a lot going on.
So it's interesting because I actually have been kind of anti-scissor, and the reason I'm anti-scissor is because they just do the simple cut and no exercises, no training, no rehab, and really what's happening is the baby neurologically, and I love you said suck, swallow, breathe is such a coordinated, it's a highly coordinated event that should be natural, should come easy, but if there's any discoordination or discommunication, lack of connection within the cranial nerves, within the spinal nerves, then it's not going to happen. It's not going to be a coordinated, efficient event, and nursing should be efficient. And so you look at that of going, we go and we cut and we don't clear out anything else. It makes total sense why some of these cuts will heal or back as a keloid formation and be even worse, because I've seen some of those. But really, as you're saying that, of going, no, here's the benefit of a cut, because we're assuming we're doing a very simple cut with and in conjunction of, because we don't have all these layers that we now have. But if we can keep it simple and have a solution with it, which is we're going to reestablish tone in the body. We're going to establish ease within the body. Now
and that's
changes.
The thing. Even whether it's a scissor or the laser, it is a little bit of a traumatic event. All of us, when we experience trauma, have a little bit of a shock response, a little bit of a freeze response, which is going to absolutely go against than them being able to suck, swallow, and breathe and coordinate things, because their nervous system has had a little bit of an input to it. And so you need to talk about that too. Honestly, again, going back to the idea that babies are so aware, even just the simple step of telling your baby, okay, this is what's going to happen. This little tissue down here is holding your tongue down, and it's making it hard for you. We're going to take that out a little bit, however you're going to do it.
Right.
And it's going to hurt for a minute, but I am right here, and you can do this. And as soon as it's over, I'm going to put you right on my chest. You're going to nurse. I'm going to comfort you. You're going to be okay. Giving them, I mean, and I literally say exactly like that.
To your child,
talk to your baby. They understand on some level.
Absolutely. It's like even just pulling in that energy. And I know I'm a processor out loud. And so it's like when I say that, that would help me as a mom to be like, here it is, like I'm communicating with my baby. And it reminds me that I'm doing what I know is the best.
Right.
Because we're all trying to do the very best we can.
Absolutely.
And we communicate this through, and then we're setting that intention that it's going to be successful and that we're going to have connection immediately and we're going to heal through this together.
You're not going to do it alone.
Right.
All of us do hard things all the time. It's just easier to do it when we know we're not alone.
Right.
Or that we're by ourselves.
You're right. Absolutely. And that I will have this reconnect at the end.
Right.
So what is, in your opinion, the very best way to navigate into a revision or coming out of a revision? I will off preface, so you can say whatever you want. I actually love to say to people, I would rather see a child before a revision than wait till after. And I know for a lot of people, it's like, and I guess I love that you're nodding, and I'd love for you to answer the why. Why before?
The why is because there are a lot of babies that are right in that gray area that you mentioned, where they might benefit from a revision, but they might benefit enough from just the body work. And then why do a procedure if you don't have to? That's one reason. Second reason is it is a whole body. Everything's connected. And so even if it's the frenulum and it's tight right here, it has to do with midline development, embryological development. There was a little glitch.
Right, there was.
Okay, so it's not going to just be impacting this. My granddaughter, my first granddaughter, when she was born, she opened her mouth to cry, and everybody's like, "Oh, there's a frenulum." But
those are the easy ones.
I know it was. It's actually a huge teaching moment for me.
Absolutely.
Because we had the ENT, who was a close family friend, who was going to do her revision, but his policy, and I love this about him. His policy was, I don't do any revisions until my lactation consultant has
met with them first.
And so,
what a beautiful way.
It was beautiful. In our case, it was the lactation consultant got sick, so we had to postpone it a week, and then the friend went on vacation to Hawaii for a week. So it was 3 weeks.
Really matter. Like it does. It so matters. Yes.
She was doing okay. I was doing cranial on her. Those whole 3 weeks beforehand, but I got to see the midline impact of what was going on from the frenulum. Everything that was going on from birth, because birth is an intense experience and things have to go back into place. And so it was a huge teaching experience for me to be like, okay, so this was molding. Here's the frenulum. This is what I feel going down her midline. This little thing in her sacrum. It feels like it's connected to both birth and the frenulum.
Absolutely.
So she was getting work done that whole time, and 3 weeks, then little scissor snip. She was on the breast within like 2 minutes, and she did great. So I could see what was birth, what was frenulum, where they intersected. It was a really interesting, great teaching for me of how that worked.
It reminds me, and I'll share this story as well. We've talked right before as we came on of going, there's a time and place for frenulum and for the actual revision. And we both are obviously agree on that one of saying there's a time.
Yes.
And when you're in that gray area, and I remember I had one mom, and it was a couple of years ago, had one mom babies in the little gray area, and I was like, well, let's start with the care that we do. And I also got my training through Upledger, and I went further on with other courses as well. So I do cranial work in conjunction. And so it's funny because she was another like 3 to 4 weeker before she could get in, and I had done all this work with this baby, and the dentist sees them and is like, very much like, because we referred, why did Dr. Stitcher refer you down here? Like, there's not an issue. I don't need to do anything. And I was like, Because, and that's like, that's
Right.
it's one of those that we celebrate, because when you're on the edge, they may need a revision. But I would go, let's start with least intervention first. Let's start with the
Right.
body work, which is going to prep them for the revision if they need it. It's going to help their body unwind faster through it.
Recover better after it.
Absolutely. And there's a chance that they may not need it because their body's able to work through it.
I don't know how many, many babies
Yes.
I've had who ended up not needing it because it wasn't just the frenulum.
Right.
You know, I have a frenulum. I
Yep.
can feel
Right.
my frenulum,
Yeah. Mhm.
but it doesn't restrict my motion.
Right.
And again, there are times when it
Yes.
really is obvious.
Yeah. Mhm.
This one does need to be cut. It is
Yes.
impacting
Yep.
function of the tongue. But there is a pretty big gray area.
Yeah.
And then there's some where it absolutely is not the frenulum, it is other things.
Right.
And if you can clear it, I mean, I would probably say that's 70%.
Right.
60 to 70% of
Right.
the babies
if you're
I see.
Exactly. If you're looking at nursing issues, feeding
Right.
issues, I think everyone's thinking it's a revision or a TOTS, tethered oral tissue, and we're finding, because I agree with you, we're finding that that is not, like, it actually, it's easy when we get like, yeah, check mark, they need a revision, because it's easy. But often, the majority of the cases, it's not, or it's the maybe, and it really is what else is contributing to this.
Right.
That really is the issue.
And those are the things that you can easily support and address with the body work that we do, so that they can function, they don't have to go through a procedure, they can feed, everybody's calmer, but then long term as well. Those things that they probably over time could get over, but downstream it might lead them to being susceptible to migraines.
Absolutely.
Or set them up for an injury when they're playing tennis.
Right.
Whatever it is that they're doing, getting those things cleared as an infant and realigned so they can just be in their body comfortably. It's all good.
Well, and this is where, like, I love that you went there, because I was like, that's where we have to go next. Is so many people will come in and say, I want you to treat my baby for this. And the answer is, and I've actually kind of made even dentists mad, or even lactation, because they're like, well, it's a lactation issue. I go, well, you sent them in because you saw the symptoms of lactation, and then I look at the whole body, and we look at the whole body, and we find actually there's all these other things that are going on which really need to be addressed in order to see the change here.
Right.
And so some people are overwhelmed because they're thinking, well, it just should have been like a cleanup. And I go, but your baby went through a massive event, and the research is that 99% of babies are injured, big T, big trauma, little trauma, so we'll say the degrees is different, but 99% of them had a restriction to their cranium or to their spine from birth. And if we know that, and they don't get it fixed as a baby, then what about all these health issues that come out later
Absolutely.
on? And we go, but we don't want to wait until there's health issues. And so we appreciate that they're coming in with the nursing issues or the eating issues, but really we're looking big picture.
Right.
And we're really setting your child up for health, longevity, connection, communication within, which means communication with others.
Right.
I look at that going, that's really the greater service that I want to share.
Me too. Absolutely.
Yeah.
Communication is a big thing for me. And that's one of the reasons why I love doing cranial sacral therapy with pregnant women. Because if you can facilitate a mom being able to communicate with her unborn child, not talking at them, like, oh, hi, baby, but coming in and communicating with their baby. If a mom can hear her fetus when that child is 15, they're going to be listening to each other in a very different way than they would have otherwise. And I've worked on so many families where the mom didn't get cranial until like the last baby. So 3 or 4 kids, last one gets it, and they're like, I hear them differently. Our relationship feels like it's on a deeper level. Not that they don't absolutely adore their other kids, because they do, but it's that communication piece.
It's another awareness that we're able to open up, and I go, ooh, that's
I mean,
that's so
those
cool.
are the ones that I know their lives are different in a positive way because of what happened.
And
in utero, at birth, postpartum.
And forever different. Like
forever different.
And you look at how
lifelong changes in their relationships.
And how do we help in a society that's full of fear, full of disconnect, full of lack of trust, and go, this is how we help, is we reestablish, and I do believe when we reestablish connection and communication within the body, then it allows connection, communication with each other. It allows trust to be built. It allows trust within the body, that we're not being raised that my body must be weak, sick, diseased, or dying. which is a really good salesmanship of a few companies that run a lot of things in this country. And so instead we're coming here going, no, your body's powerful and capable, and it is designed to heal and repair, and health is a birthright. And here's how we facilitate health.
With all of my pregnant moms, I give them this birth affirmations. I didn't write it. I don't know who did, because I didn't give credit to where I found it. But one of the things it says is, I am strong. My contractions can't be stronger than me, because they are me. I am strong and powerful, and I know how to do this. And my baby knows how to do this. And I love that, because it speaks to what you were just saying, that the empowering, our bodies have this innate self-healing ability. In Cranial, we call it the inner wisdom or the inner physician, but we all have it. And so when you can help someone connect in with their own inner wisdom, they're at the source. Everything can be better because they've learned how to listen to their own self. Not that we sometimes, I'm pretty good at listening to my inner wisdom. I still need help.
Absolutely.
Sometimes.
I think that's a really...
not saying you don't need support.
Right. No. And you receive care.
I do.
And you receive body work, and I receive body work. And I think it's one thing you'll find is like, and I will joke, if you talk to a natural healthcare provider and you ask us, like, do we put our money where our mouth is? Trust us. We do. Because we
if
understand
you don't go to that person.
Go to them. Thank you. And so it's never one of going, I'm an island and I want people to only see me. That's first of all another red flag. The other part of it is going, I understand that healing is a multifaceted journey, and for me to be whole in every way that holism looks, I'm going to combine the best of everyone's wisdom within my inner wisdom, which I love that and it is, and then time and place for what feels right. And so I think it's really a beautiful opportunity that we have as providers to get together, share, empower, educate, and tell you there's so many options you guys have for you. As you're talking, like pregnant mom, which means postpartum. Postpartum journey is forever. I love that expression because I've really owned that as a mom as well, that our bodies are forever changed. And I believe in a beautiful way that we've literally helped create a human, grow a human, birth a human, and become a mom. I love, and I will not quote it properly at all, but in this process of labor, we actually birth a whole new person, which is us as a mom. And that's one of the reasons that sometimes labor has to be work, and because of what we're going through, and yet the whole thing we get to be part of. I so appreciate you being here.
Thank you.
So if people this is wonderful. So if people are, they're local, how do they reach out to you?
So we, again, I work at my son's office, so their website to do online booking is MuscleWorksChiro.com.
And I'll put that in the notes, so we're totally fine.
Yes. So I will say, I'm very booked up.
Yep, I know.
And so
we love it. That's why she's on this.
I do have two other lovely cranial sacral therapists who work with me. So Janelle Maxwell and Jenny Bloy. And so you can schedule with them online as well. But I do make this caveat that if you are a mom and your baby is struggling with breastfeeding, babies need to eat, and that's a priority for me. So in that case, call the office.
Exactly.
And we will make it work.
Okay. Now they're not local, and they want to see someone who has this type of mindset and training. How would you make that recommendation?
So if you go to the International Alliance of Healthcare Practitioners, which is IAHP.com.
We'll share that as well.
There's a directory there, and you can put in your area code. So not your area code, your zip code. Like 3 or 4 digits of your zip code, and it will do a search of people who've been trained in cranial sacral therapy.
Awesome.
So you can find someone that way.
I love the fact, I have to say, when it was my first year in chiropractic school is what got me into Upledger, and it changed my life in such a beautiful way to incorporate and have this as part of who I am as a provider. And then I defer to cranial sacral therapists. I go, no, I do a piece, I have it as a portion, but you need the whole thing. And like 10-step protocol, I'm like, yes, like that's when you're really truly giving the time, energy, and effort into it. And I love that that's when I started as a chiropractor. Now we get to be on this flip side of going, help teach your son and go, this is an amazing profession. When I say profession, I mean healing arts. This is an amazing time to be in the healing arts and to be uplifting other people and go, it's only going to get better because it has to get better. And people are looking at what their options are, and they're frustrated, and they're saying, I innately believe there's more to health than just avoiding sickness.
Can I add one more piece to that?
Of course.
So particularly right now with mental health being such a big, have people having a greater awareness of mental health and its importance and how it affects everything in our lives. One of the things that I absolutely love about craniosacral therapy is that there's this natural adjunct of somato-emotional release. So soma, meaning your body, so releasing the emotions that we're holding in our tissues. And I'm saying this one because if you go to see a craniosacral therapist, an advanced therapist, then it is very common for you to start crying on someone's table. And if you're not aware of that, I just want you to be aware that there's a big emotional piece that we actually, you can't separate the emotion from the physical.
Right.
And so it's a lovely way to support that emotional processing that all of us need to do. We're all, again, our life experience is all in here. And so it's a way to address those issues as well, treating the whole person. So
I love
Don't
that.
be worried if you cry on someone's
And
table.
be prepared to cry. Because think of that true healing that deeper, not even true, but the deeper healing because you literally connected with the inner wisdom and just let it flow, baby.
Yep.
Because the healing's going to happen.
I
Exactly.
say that Shrek said it right.
Shrek did
Things
say
better
it.
out than
Exactly.
in.
So Kim, thank you so much. Oh, I so appreciate the time with you. This is wonderful information. I will give you guys all the stuff in the show notes to reach out. This is really one. I love that we've talked business, we've talked mom, we've talked into birth world and babies.
The whole
it really
person.
is everything.
Yeah.
Because that's what it is. And the different aspects we get to have, the different experiences, and then our journeys have impacted us to be the providers we can be, and I so appreciate that piece as well.
Getting to this point in my life and realizing everything that I am
Yep.
makes me the therapist that I am, or the mom that I am,
Yep.
or whoever the human being that I am.
And there's a lot of forgiveness and grace in that,
There is.
rather than guilt and shame.
Exactly.
And I think as you go to that mental health piece where everyone's trying to say guilt and shame is so bad, and I go, I agree. Let's instead talk grace and compassion, which has to start here. And if we don't have grace and compassion here, it's really hard to grant it to someone else.
Exactly.
And all of these experiences can help just in so many ways. So thank you so much for being part of this podcast, you guys.
Fun.
This has
I've
been
really
wonderful.
enjoyed
This is the reason we do this, is to give you guys this type of information. I hope this helps a lot. Please share, let other people know about this, because the whole goal we have is just to increase awareness and empower you to make the best decisions you can for yourself and your family and what's appropriate for you. So enjoy the rest of your day.